Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell International. Today we're discussing stem cell therapy for multiple sclerosis. Okay, so I'm going to go through some facts on MS, the symptoms and progression, traditional treatment options, and then we'll delve into stem cell therapy, what some of the research shows, and I'll talk to you about the R3 International program for MS. So, what is multiple sclerosis? Well, it's an inflammatory disease of the central nervous system that may result in severe disability and neurological deficits. Onset is typically between the ages of 20 and 40, and it's twice as common in females than males. There are four subtypes of MS. RRMS, which is relapsing remitting MS, is most common, and exacerbations followed by periods of remission are typical for RRMS. Secondary progressive, some people who have RRMS will eventually transition into a secondary progressive course. Primary progressive MS is characterized by worsening neurologic function from the onset without early relapses or remissions, and the least common form is progressive relapsing. Causes multiple sclerosis. Well, we're not really sure. We do know that there's damage of the myelin sheath, which is the surrounding of nerves, and that results in disruption of normal conduction and nerve impulses. There's a common belief that it's part of an autoimmune disease, but it's not definitive. So what are the numbers? Well, we do know, as I mentioned, that females are affected twice as commonly as males. There are between 2 and 3 million people affected worldwide. It's the most common cause of neurological disability in young adults around the world. About half of those affected are in Europe. There's also about 1 million cases in the US, and then there's other cases throughout the rest of the world. So what are the symptoms? Well, they're going to vary because it's such a non-homogeneous situation when someone has MS. It may cause slurred speech, fatigue, dizziness, tingling or pain in parts of the body, and it can lead to problems with sexual, bowel, and bladder function. It can also lead to numbness or weakness, electrical shock sensations, tremor, lack of coordination, or an unsteady gait. Visual problems are also common, blurred vision, double vision, or partial issues with vision. There's no specific test that will diagnose MS. Usually it's a full spectrum of blood test, MRI, spinal tap, evoked potentials. The treatment typically focuses on speeding recovery from the attacks, slowing the progression of the disease, and symptomatic management. This may include various steroids, plasmapheresis. There are very, very few FDA-approved medications. One of those is Ocrevus. There are lots of off-label medications that are used, way too many to list. Additional treatments may include physical therapy, muscle relaxers, antidepressants. So these may reduce the frequency of exacerbations and slow the disease progression, but actually none of these have been shown to help with the myelin sheath or nerve regenerative capability. So let's start delving into stem cell therapy for MS. It really is the newest technology for a disease like MS, ALS. Now, there are several ways that stem cell therapy works in the body. I've listed the most common ones here. Paracrine interactions involves cell-to-cell communication. A lot of people think that when they get a stem cell therapy, those are the stem cells that are going to actually turn into the specialty cells in a person's body, and that's actually not predominantly how they work. Paracrine interactions, stem cells are very active in communicating what they need to be done within a person's body, so that's what paracrine interactions are. Immune modulation can be very helpful in amping up protective interleukins and other proteins and tamping down harmful ones. So, for instance, in a person who has an autoimmune disease, it can help to mitigate the body fighting against itself. Also, we do know that diseases like MS, ALS, and others have increased inflammation that can be harmful to the central nervous system, and the stem cells are very good at reducing that inflammation. There's also some direct mechanisms, which we don't understand really, really well. And then there's a teamwork approach. When you get a stem cell biologic at one of R3's centers, the biologic includes a lot of regenerative elements. It's not just stem cells. There's exosomes, there's secretomes, cytokines, growth factors. They all work together, almost like a philharmonic orchestra, where the sum is much greater than the parts. All right, so it needs to be noted first off that stem cell therapy for MS, or pretty much any condition, is not a cure, okay? The goal is to significantly slow down or even halt progression for a decent period of time. We want to use stem cells to optimally achieve long-term remission, possibly some meaningful functional recovery with biologics that are very safe, that provide way more benefit than risks. And what you'll find with any of these stem cell therapies for various conditions is that you're going to have three different potentials. Some people are not going to respond well no matter how many stem cells or how high quality that get used. Others will be medium responders, which is what we typically see, where patients do get a great outcome that they're very happy with. And then, thankfully, we do have some super responders, which are people who get way more function back than we ever thought possible. All right, so let's go through a few studies. This study was actually for ALS, but I put it in here to show that intrathecal application of stem cells is very safe. We do it frequently throughout the world at our clinics. In this study, they gave patients several intrathecal injections of 1 million stem cells per kilogram. They had no significant adverse events. These patients did very well. So I wanted to point that out first of all. All right, so here's an article, umbilical cord mesenchymal stem cell transplantation in the treatment of MS. This was a 2018 study out of China. It only had 2 patients. They did follow these patients for 8 years. They used 2 million umbilical cord stem cells per kilogram every 3 months. So considering the average individual weighs around 70 kilograms, that's 140 or 150 million stem cells times 7. So if you do the math, that's about 1 billion stem cells on average that they gave them over that period of time. They did serial MRIs on both of these patients, which showed a significant decrease in lesions. And when they did that, they noted that most likely the umbilical cord mesenchymal stem cells promoted re-myelination. All right. They also showed changes in various interleukins with inhibition of some of the harmful ones, IL-17C and IL-2. This was a great study looking at 20 patients in Panama who received 20 million umbilical cord mesenchymal stem cells times 7 visits over a period of a month. So that's 140 million stem cells. They didn't have any significant adverse events, just some minor ones like headache, dizziness, fatigue, which resolved within a day. Most categories they looked at, and they looked at a lot, improved at 1 month and then slipped slightly at the 1 year evaluation period. So what that suggested is that treatment frequency should be more than once a year to continue to keep the improvements in the quality of living. And they noted that in this small study of 20 patients, they had improvement in bladder function, bowel function, sexual function, walking, upper extremity physical function, better energy, less fatigue, and in their quality of life questionnaires, patients got significant improvements as well. Great study. All right, here's a study, the potential of human umbilical cord-derived mesenchymal stem cells for MS. This was 2014 with 23 patients followed for a year. So in this one, they did 4 million cells per kilogram 3 times every 2 weeks. So when you do the math, that's also a pretty high number. I mean, if the average person, once again, weighs 70 kilograms, that's 280 million cells times 3, which is close to 900 million. So the data show that the anti-inflammatory Th2 cytokines had remarkable increases in the experimental group. They also had significant decreases in the pro-inflammatory cytokines. So they were very helpful with amping up the good ones and tamping down the bad ones. They had significantly lower relapse occurrences and increase in function found in the experimental group compared to the control group. So a lot of improvements in that study. I do want to mention that at R3 International, we don't use any embryonic stem cells or induced pluripotent stem cells. Why? The reason is those are not ready for prime time. They can have significant problems like tumor formation or rejection in the body. We've never seen a rejection reaction in over 16,000 stem cell procedures around the world. If anyone suggests to you that you should have an embryonic or an induced pluripotent stem cell therapy, you should run away. We only use mesenchymal stem cells and or hematopoietic stem cells. That's the way to go. When you look at our international treatment program, we really combined all the essentials for a first-rate program for MS. We have really expert doctors who've done lots of these cases. You will have a dedicated patient concierge representative. The biologics are very safe, and we use very high stem cell counts. You got to make sure that the patient gets what they need, and we have very convenient locations. Internationally, you are allowed to culture biologics, so we do. That way it makes it much more cost effective for patients. We have accredited labs that have quality assurance standards that exceed what the FDA does here in the US. The cells are kept to the 5th generation or less, meaning they're very pure, potent, viable, and active. We don't need to use preservative. We have over 95% viability of the stem cells. For transportation, our treatment centers are less than 20 minutes from the airport in the various cities. We do provide transportation from the airport to the clinic, hotel, and back. And we would help with setting up airfare and whatnot. That is the patient's responsibility, though. We have the most cost-effective multiple sclerosis stem cell programs in the world, hands down. Depending on a patient's needs, we offer 3 programs for MS, which start at only $7,450. The first one would be 100 million umbilical cord mesenchymal stem cells. We do also include 30 to 50 billion exosomes. We found those can help substantially. And that treatment is done in 1 day. We use a combination of intrathecal plus intravenous. If the patient needs 200 million stem cells, we have that program too. You also get at least 50 billion exosomes, and that takes 2 to 3 days. Once again, intrathecal and IV application. We do also have a third program, which is the first in the world to offer 1 billion stem cells. Yes, that's with a B, 1 billion stem cells. And that's a combination of umbilical cord mesenchymal stem cells plus exosomes. We also have a center in Honduras that offers adipose autologous as well. So it's a great program. Those take 10 to 12 days overall. And once again, it's a combination of intrathecal and IV as well. So R3's been featured on every major media outlet you can think of. We've been voted 10 best companies of the year, 10 most innovative companies of the year, USA's leading regenerative therapies provider. To get the process started with a phone consultation is easy. You can visit us online at r3stem.com and then call us on a USA prefix +1 888-988-0515. Thanks very much for watching, and we look forward to hearing from you.